Okay, so Ms. Birch, so please share with us what type of symptom you had prior to coming to see us.
When I came, I had foggy brain, sleepiness, daytime sleepiness, stomach pain that I thought was related to my gastric bypass, which apparently was not. I had neuropathy, both feet. I was on pain medication for about 9 years, a Vicodin every night.
Wow.
For 9 years, and sometimes 2, depending on the neuropathy pain, the burning and the tingling. That was really hard. That was very difficult. But when I started the treatment, especially with the nerve stimulation, the foot in the water bath with the electrodes, that really helped. About 2 weeks into the treatment, I could tell that it was affecting the feet. I wasn't having the pain, but I stopped taking the pain medication just as I decided I'm just going to get rid of the pain med. I'm not going to take it.
Because you didn't need it anymore.
I didn't need it anymore.
Yeah. And what other things did you notice change about your feet?
I had hammer toes, and they started to relax and flatten. I had skin discoloration and dryness, and it looked really bad. I thought it looked like that toe was dying. The nail absolutely had to come off of my right great toe because it was rubbing on my shoe.
Sure.
Now that nail is improved. I'm not going to need surgery on that foot, I don't feel, because I don't have problems with a hammer toe on that side any longer. The left foot, did have foot surgery, but I think the color is looking better. I have sensation. I can feel the touch on my skin, which I hadn't felt before. I had numbness completely up to about right at the ankle. But now I do have, I can have sensation. I can feel it. I still have some difficulty with heat, the sensation of heat, like walking into a hot tub. Sometimes gets almost to my knees before I realize that I'm in.
And how about what kind of low back trouble did you have? You had surgery and so forth?
I had a gastric bypass, but I've never had any back surgery, but I always had low back pain, and they told me as a child I had spondylolisthesis and a narrow SI joint, so I've always dealt with low back pain. Walked with a slight limp. The left hip was higher than the other.
So how long have you had back pain?
Forever, since I was about 12. I saw an orthopedic surgeon when I was 12 because I had sciatica pain and spent the summer sort of sitting out in a lounge chair in the backyard because I could hardly walk. It was
So what
painful.
level is your pain now?
I don't have any back pain.
So you have back pain your whole life?
I've had it my whole
and
life.
You don't have any pain now?
No.
After,
No.
what, how long have we been on this?
For about 8 weeks.
8 weeks.
8 weeks.
That's amazing.
And the stretching has just improved my circulation. It has improved the nerves. I'm just, I feel like my back is so much better.
Now, as far as the nutrition stuff that we did with you to help you with the various metabolic issues, how has that improved?
That has improved the protein that I'm taking, the pea, the other supplements have certainly helped, the H. pylori and the
so you had a lot of bloating and stomach
gas,
issues, burning.
Yes, stomach burning.
That's all improved.
Improved, and I would not have maybe 2 bowel movements a week, and now I'm having at least 1 every other day, and sometimes every day.
That's
which
great.
has really improved.
How about fatigue and brain fog?
No, I'm much better with that. In fact, I applied for a new job and got it because
That's
I
awesome.
felt like I was feeling better, and I thought I can do this. I don't want to quit work. I'm probably going to be working. They'll find me there.
So what do you do for work?
I mean, what is my position?
Yeah, what is your
I'm
position?
a nurse. I've been a nurse 48 years. I'm an educator. I'm a operating room educator, peri-op services, so it's endo and PACU and the pre-op
So
holding.
you teach other nurses
people
how to do their job. Okay.
Yes. And so now my new job will be similar vein. I will be teaching academies, so it'll be the entry level information that people need to function in those specific areas, those specific roles for the
And
working
this is
at
for
the
which hospital now?
Banner.
Okay.
Health.
So you're in the medical system for
Yes.
your whole life.
Yes.
But yet you have these, back pain, neuropathy issues,
And
gastric issues
Just
that
thought
wasn't
it's
addressed.
the job. It was because my any medical doctor that I went to, this was just kind of okay. It's just part of living. You're a nurse. You're on your feet, so your feet are going to bother you, and you have an upset stomach because of the stress. And I was overweight. I had thyroid issues, pre-diabetic, I'm sure, and I'm thinking the
Yeah.
neuropathy was pre-diabetic.
Sure. I mean, there's no knock on the MDs.
No,
They're great
no,
doctors.
but
It's
they just didn't know
how to
they
fix
didn't know how to
this.
fix it.
Right.
And so they tried drugs, they tried medications. I'm off the. I've gone off my naproxen to only
Mhm.
3 days a week. I
Mhm.
don't take the pain medication.
Right. And
any
you didn't have to
longer.
take any stomach medication, right? You were
no.
taking Rolaids and
I was using Tums at night. I mean, I could eat a whole bottle, just about a whole bottle, to try and
Wow.
quell the.
and you no
pain.
longer need them.
Just occasionally, but I think it's because I had milk and I shouldn't have the milk. Now I
Sure.
know that, so
Okay,
I
great.
don't want to go through that.
So
pain.
how do you feel like this program is different than the other approaches that you have tried?
It is actually going to the core of what my issues were, not just treating the symptoms, but actually treating the issue, the problem. I mean, now I'm the H. pylori and the parasite being treated, the sugar, the allergies. I have an egg allergy. I didn't know that.
Hmm.
So
So we discover
you
things
discover
that your
things
doctor
that
may
I
not have
met-
found.
And I'd had allergy testing in the past, and that was completely missed.